Contraception is defined as the intentional prevention of conception through the use of various devices, sexual practices, chemicals, drugs, or surgical procedures. And the devices or acts that are used to prevent a woman from becoming pregnant can be considered as a contraceptive or a contraceptive method. The main purpose of the contraception is to prevent unwanted pregnancies and freedom to have children when desired, but it adds another protection, that is protection from sexually transmitted diseases, STDs. Like condoms, they would be a mechanical barrier to the transmission of diseases from one partner to another. In past, female were thought to control the conception and birth. So the female contraceptive methods, they are most developed and most diverse types of methods as compared to male methods. So we can divide female contraceptive methods into three categories, that are traditional methods, modern methods, and most modern methods. In traditional methods, coitus interruptus or withdrawal is the most easiest method, that is to withdraw the penis before ejaculation from vagina, and but it is least effective method. So there could be sperms in the pre-ejaculate that can result in an unwanted pregnancy. And then lactation amenorrhea method, it is again uh, an easy method, but it is again less effective. The female after birth, they keep on lactating their children for longer time in order to keep the prolactin levels high in body in order to suppress gonadotropes and gonadotropin hormone. Then there is rhythm method. Rhythm method is related to the uh, to intercourse during the infertile period of the cycle, menstrual cycle. So they would avoid the uh, ovulation time, but it is again a less effective method, because the sperms, they can survive for up to 7 days. So there could be chances of the uh, conception. The modern methods are development of mechanical or physical condoms for female, and then in most modern methods there are development of oral contraceptive pills, injectables, emergency contraceptive pills, diaphragm and spermicides that are barriers. And then the chemical methods are also there, implants, they would be hormonal. And then there could be surgical methods that involve the placement of intrauterine devices, and the female sterilization that involves tubotomy, cutting and ligation of the tubes. And we'll see these all methods in detail in the next section. The most effective and most being used method for female contraception is hormonal contraception. And hormonal contraceptives could be combined, could be progesterone only. Combined mean they are combined with estradiol. So in case of combined, there would be two type of combined pills, that are oral contraceptive pills that are also called as OCPs. And then there is placement of rings and placement of or attaching patches on the body or the surface. So in case of progesterone only pills, there are injectables, there are pills, there are implants, and then there are intrauterine devices. Here we have a brief history of hormonal contraception for women, how they were developed and why they were developed. Because in 1940, the government authorities they thought that population is increasing explosively, and the condoms and diaphragms that were being used at that time were not very effective, and their acceptability was also a concern because they were being made from animal tissues and plastic. So there was search for new methods that should be effective and that should give more control to women to control their conception and birth, because men at that time were more in power and careless because they were not bearing the children and not bearing the expenses to the brought up the children. So women they were more underprivileged. So these contraceptive methods that were developed for men were least effective because men were careless. So the methods were searched to give more control to women. So for this, now we see a lot of contraceptive methods for women but few for men. As we saw previously, that hormonal contraceptions and various other invasive type of techniques they are still under trials for men, but they are well developed for women. And the reason was this, that is to give control. At that time it was intended to give control to women. So the story started with synthetic progesterone, and then the progesterone it was given alone. At that time the progesterone it was causing and the thinness of endometrium. So there was a lot of cases of breakthrough bleeding, that is the uh, bleeding due to thinning of endometrium. And then later on the synthetic testosterone and derivatives they were also used, and then the estrogen it was added to the progesterone pills, and it was seen positive effect to cure this breakthrough bleeding, because estrogen we know proliferates endometrium, and progesterone it stabilizes the endometrium. So when there would be thinness due to progesterone, the at that time the estrogen it proliferates, so there would be an equilibrium between the thinning and the proliferation, so there would be no bleeding. And so the combined oral pills they were made, and they were found more effective and having very few or very less and less harmful side effects. As we know, the mechanism behind oral contraceptive pills is very simple. The progesterone in the pills is the main component, and it gives negative feedback to the pituitary because it is being given from outside, so it is inhibiting LH and FSH, that is luteinizing hormone and follicle stimulating hormone, to dormant the ovaries, because when LH and FSH would not be there, there would be no follicular growth and ovulation and the release of estrogen. So the progesterone it is giving negative feedback, and then it is also helping in the thickening of the cervical mucus. The cervix it is the portion that is next to the vagina, and it is linking vagina to uterus. So this region, that is cervix, it has a lot of mucus glands, and if this mucus it get thick, the sperms they cannot easily cross cervix to reach uterus and uterine tubes for fertilization. So the in normal condition when there would be pregnancy, the cervix mucus it get thickened because of the release of a lot of progesterone. So same when we give it from outside, progesterone from outside, it would it would help to increase thickness of the mucus in cervix, that would hinder the passage of sperms. Then it also decreases tubal transport because the tubes they are contractiles, and the for example fimbres of the uh, uterine tubes, when the estrogen levels are high or the ovaries they are under normal cyclicity, when there are high levels of estrogen at the ovulation, these fimbres are the fingers of the ovarian sorry uterine tubes, they would sweep on the ovaries in order to collect ovum. And similarly the uterine tubes they would be contractile for the passage of these ova down toward the ampulla in order to get it fertilized. But when there is high level of progesterone and low levels of estrogen, these tubal transport they would decrease. Then the progesterone it would thin it would help to thin the endometrium. So endometrium it would not develop a lot to conceive the fertilized egg. So but that would result in a drawback, that is the breakthrough bleeding. So in order to hinder this breakthrough bleeding, there is given estrogen along with progesterone. So this estrogen it would inhibit LH and FSH through negative feedback, and it also helps to increase efficacy of progesterone. It develops the receptors of progesterone at various places in order to increase efficacy of progesterone. And then it prevents breakthrough bleeding, that is due to thinning of endometrium because of progesterone, because estrogen it helps to develop the proliferate the endometrium. So the OCPs or oral contraceptive pills, they have certain advantages and disadvantages. They have low failure when we use them on correct time, and effective use is there. And the for typical use they are effective for 92%. 8% is the failure in case of when people they use them casually, the women they use them casually. But if they are using them cautiously, it would give up to the 99.7% efficacy, and only 0.3% is the failure. So there are other uses of these oral contraceptive pills other than the contraception in medical cases. For example, abnormal uterine bleeding, as we know, the uterine bleeding they would be due to thinning of the uterus or the endometrium. So these OCPs they would help to decrease uterine bleeding if it is due to any other reason also. Then in case of heavy menstrual bleeding, again it is helpful. Heavy menstrual bleeding is also called as menorrhagia, and these oral contraceptive pills they would help it. Endometriosis is also uh, being cured by these pills. And then mid-cycle pain, dysmenorrhea, that are the pain related to painful menses, PCOS, polycystic ovarian syndrome, acne, risk of ectopic pregnancy, hirsutism, and they all are done by decreasing the testosterone level and increasing the sex hormone binding globulin to bind testosterone. So testosterone would be reduced, and The conditions or the symptoms of hirsutism and the acne, PCOS, endometriosis, they would be less, and the pains that are associated with these conditions would be reduced, like endometriosis and dysmenorrhea. And then it also helped to decrease pelvic inflammatory diseases, because the female reproductive tract, it is more open to the external environment as compared to the male reproductive system. So the females, they have a lot of infectious diseases in the lower abdomen. So these diseases, they would be reduced, infections, they would be reduced if the mucus in cervix is thick, so it would not allow the passage of microbes into the upper reproductive tract. And then these oral contraceptive pills, they are also being used for prevention of colon cancers and cancer of ovaries and endometrium. Previously, high uh, concentration of estradiol were being used. So high levels of estradiol are associated with nausea, vomiting, gastrointestinal and cardiovascular and coagulation symptoms. So, but now the low levels of estradiol are being used, because the uh, use of estradiol is only to hinder the uh, breakthrough bleeding from the uterus or endometrium. So there are studies that also tells that the oral contraceptive pills, they are associated with cervical and hepatic cancer, but it is the studies are few, but there are evidences. Then there are controversies that they are associated with breast cancer, but these studies, they are controversial. Then they are also found to be associated with thrombosis, and the so the estrogen, it is associated with the formation of more coagulation factors. So these coagulation factor, they would result in the formation of clot in blood vessel, that is called as thrombosis. These clots, they can block blood supply to certain areas where they are located, and also can lodge to another sensitive area of the uh, circulatory system, like the blood vessel that are going into the central nervous system. So but again, it is not very confirmed. There are evidences that the oral contraceptive pills, they are associated with thrombosis. Then there are contraindication that the oral contraceptive pills, they should not be used if the women, they are smoking, they have history of thrombosis, mean family history is there, or the personal previous history of formation of clot. And then there could be the another indication is coronary artery disease. If they have coronary artery disease, then they should not be prescribed oral contraceptive pills. If they have history of stroke, hypertension, and valvular disease, migraine, breast cancer, and liver dysfunction. So these are the contraindication for the use of these contraceptive pills. Another method of the hormonal contraception is transdermal patches. These patches, they are applied on skin. So these patches, they would be used for 3 weeks, and 1 week would be free. And the medicine present in the patches would get absorbed into the skin and into blood directly. So they would avoid again the liver, and so there would be less or no damage to liver. So a patch is required every time to place on the skin for uh, all the weeks. So one patch per week is being used. Other than oral contraceptive pills, another most accepted and the reliable method is using the combined estrogen progesterone rings that are plastic rings that are blue or white containing estrogen, and they are placed in vagina. So in this case, low levels of estrogens are required because the estrogen has to be directly absorbed from the reproductive tract into the reproductive tract and ovaries. So less levels of estrogens are required. And then another advantage of these oral contraceptive sorry the rings is that the medicine is not going directly into liver, because in case of oral medicine, the uh, medicine has to go directly from stomach into after absorption to the liver, where they can have effect on the liver and can cause hepatitis like symptoms. But in case of these rings, the estrogen, it is directly going into blood to show its effect on the destination. So the rings, they are also low levels of estrogen are also required. And then the rings are inserted on day 1 of cycle, and they are inserted for 3 weeks, and 1 week would be free in order to bring normal cyclicity to the ovaries and the uterus. And then the rings, they are removable, so the women themselves can remove these rings for 3 hours per day, and they have to place rest of the time into the uh, vagina. So every month new ring is needed, and now modern rings are being made, and they are uh, could be used for 1 year. Again, method of these rings are same, that the estrogen and progesterone present in these rings would give negative feedback to the pituitary, and they also have effect on the uterus and the ovaries, and they dormant the ovaries. Using intrauterine devices is the safe and most common method being used worldwide, and it is easily reversible, and it is effective with less than 1% failure rate, that is mostly associated with the placement of the devices inside the uterine uterus. So these placement of these intrauterine devices, they require expertise. So if a person is expert and place the this device properly, then there would be very few chances of failure or unwanted pregnancy or rejection of the device, that is called as expulsion. So there are two main type of devices that are being used, that are copper T and the levonorgestrel intrauterine system. So the copper T, they are made up of a plastic T-like structure, and then the uh, copper wire is wound on the arm of this T. They could be wound on both arms, the short arms, or it could be only on long arm, or on both the long arm and the short arm. So this copper would emit the copper ions. So there, it should be replaced after 10 years. One T would give because it is permanently placed in the uterine tube and uterus, so it would give 10 year, for 10 year it would give protection. After that it should be replaced, and it is releasing copper ion that would produce inflammatory responses in the uterus and the uterine tube in order to damage the sperms, and the environment, it becomes hostile for sperms, and sperm would not survive in that condition, in those inflammatory conditions. So levonorgestrel intrauterine system gives Other advantages, because it is having 20 microgram levonorgestrel per day, it would emit it, and it would reduce the menstrual bleeding. It would give a local progesterone effect on the uterus and uterine tissue. So mechanism of action of copper T and levonorgestrel intrauterine device, that they would cause inflammation, and this inflammatory response would affect the uh, sperms. They would not survive and move effectively, so they cannot fertilize ovum. The levonorgestrel, because it is containing progesterone, would hinder the ovulation, and it would thicken the mucus, because progesterone help to thicken the mucus in cervix, so there would be less chances of sperms to move upward toward uterus and uterine tube. And it also reduces tubal motility of the uterine tubes, so that the passage of ovum and sperm would be hindered. The timing of insertion of these T's, copper T and intrauterine system, they would be day one of cycle if the woman is not pregnant already, and could be placed after abortion, or could be placed 6 week postpartum in case of vaginal birth. In case of the caesarean birth, could be placed early, but after 6 weeks in vaginal birth, because there is movement of the uterus, and that would result in expulsion, and there are 24% chances that it would be expelled out. So the adverse effect of these copper T are that they would result in heavy or prolonged menses, because of the release of prostaglandin due to of presence of foreign body in uterus and uterine tubes. So there would be uterine stimulation, and that would result in the uh, heavy bleeding. And there could be perforation if the person that is placing copper T is not expert, would damage the uterus and the uterine tubes, and maybe this would insert into the abdominal cavity and in other tubes of the intestines, for example. So that would damage those areas. So it would be uh, it should be really it should be taken out in order to protect those tubes. And then there could be expulsion because of the uh, movement of the uh, uterus and the uterine tubes. They could be expelled out. And then there could be infection if infections are present in the uh, the infections, they are mostly related with the process. They are not related with the device itself. So device, because it is releasing certain ions, so these ions are inflammatory, or they would damage the infectious agents. But if the process is unhygienic, these infections could be passed up to the toward upper portion of the reproductive tract. Similarly, the most common and most uh, difficult uh, adverse effect would be pain. So the placement of copper T and other T's in the intrauterine devices is related with pain, and most of the time they are removed because of pain. So contraindication or pregnancy should not be placed during pregnancy, and if there are pelvic inflammatory diseases or infections already, the devices should not be placed, because it would take the infection toward upper part of the reproductive tract. And then anatomical abnormalities of uterus are there if there is fibrosis or the ligation of the uterus, blockage of uterus, then it should not be placed because there would be less room and there would be chances of perforation. Tubotomy or female sterilization is the most effective method, and it is being used to hinder the passage of ovum from ovaries into the uterine tubes for the fertilization. So there are three routes of tubotomy that are laparoscopic tubal ligation, it is laparotomy, that is the ligation of the tubes or binding of the tubes, and then there is hysteroscopic tubal ligation. So these three methods are being used. The laparoscopic tubal ligation is the most common, and it is done under general anesthesia most of the time. So a short general anesthesia is given in order to perform laparoscopic tubal ligation. So for laparoscopy, two small incisions are made in abdominal wall, and then the so these incisions, small incision up to 1 to 1.5 centimeter, they are made, and then the whole abdomen is not cut, only small incisions or the holes they are made in the skin and muscles, and then the abdomen is distended by pressurizing carbon dioxide inside about 12 millimeter mercury. So that is called as pneumoperitoneum. So it is the inflation or extension of or distension of the peritoneum in order to uh, make the internal organs visible and separate from each other. Uh, and producing a workable place inside the abdomen, because the surgeon would be only relying on the camera that is passed through one incision and then uh, the instrument from another incision. So in case of laparoscopy, two tubes are passed, one with camera and another with an instrument for ligation or for cutting or for manipulation. So the uh, camera, it would be visible on monitor showing all the internal organs of the abdomen. So the bands, rings or clips are used to ligate the tubes. So these rings, they may be called as flope rings with reference to the fallopian tubes on which they are placed, and the flope rings, they are placed on the fallopian tubes. They are fallopian tubes are recognized through the camera, and then the flope rings, they are or clips or rings or bands, they are placed on the fallopian tubes, and they are placed on the isthmus of the fallopian tube, because it is the narrower region of the tube. So we know there are three regions of the fallopian tubes: the infundibulum, that is the uh, proximal portion, and then is the laparoscopal tubal ligation is the most common method, and it is done under general anesthesia most of the time for short time, and for laparoscopic surgery, two incisions are made on the abdominal wall, and the whole abdomen is not cut, only two small incision up to 1 to 1.5 centimeter are made, and through these incision two tubes are passed. One is with to pass the camera, and another is to pass the instrument for cutting, manipulating or ligation of the tubes. And the laparoscopic surgery, it is the most common technique being used in surgery nowadays. And for this, in order to create the working place inside the abdomen is distended through the pressurizing it with carbon dioxide up to 12 millimeter mercury, and the process is called as pneumoperitoneum. So there is when the abdomen is distended, there would be more place and the organ would be easily visible on the camera that is fitted with a monitor. So the surgeon would be relying on the camera to recognize the tubes and organs. So then the bands or rings or clips are placed on the uh, uterine tube, fallopian tube that are uh, recognized through camera, and these rings, if they are being used, they are called as fallope rings. They are placed on the fallopian tube through a laparoscopic ring applicator. So this ring applicator, it is being used to place rings or the clips or the bands on the fallopian tube. So these clips or bands or rings, they are placed on the isthmus of the fallopian tube, that is the proximal portion that is near to the uterus. It is being attached to uterus. It is the most narrow portion of the tube, because the uterine tube, if we see, they have three main portions: the infundibulum, that is the most distal portion, free portion, and with which the fimbriae or finger-like projections, they are attached. So these are near to ovary, and then the region that is called as ampulla, and then after that ampulla is the region that is called as isthmus. So isthmus is the most narrower and the proximal portion that is near to uterus. So there are chances of failure, uh, although less, that if we misidentify tubes, so the rings or clips or the bands, they could be placed on any other tubes or the that are called as ligaments of the ovaries. So if the or could be placed on colons or any other tubes. So or on the uterine tube could be placed on a different place than the isthmus. So that would be that would result in failure. So identification of tubes is very important in case of laparoscopic tubal ligation. After placing rings, the or clips or bands, the part of the tube between the fold of the tube would be cut and then would be ligated with the help of clips or the bands or rings or thread, and there would be no physical connection between two parts of the fallopian tube. So the ova could not pass from the fallopian tube to the uterus. So there could be the sperms, they cannot ascend into the fallopian tube also. So there would be no fertilization at all. The laparotomy is the most effective and confirmed method of tubotomy, but it is less convenient than laparoscopic surgery, because in this case the abdominal wall is surgically opened and the suture would be used to ligate the fallopian tubes or the ends of the cut fallopian tubes and the uh, abdominal wall. And again, the isthmus is the main target. So there are mainly three methods, or there are a lot of methods, but we are dealing with these methods that are polymerized method, modified polymerized method, and electrocautery. So polymerized method and modified polymerized methods are same, because in both cases the there are very few modifications that are using the dissolvable sutures, and then in case of polymerized method, a loop is made of 1.5 to 2 centimeter, uh, by ligating the tube, and then the sutures are placed on the tube, and the uh, the loop is cut and sutures are placed. So the then histology of this cut piece would be done in order to confirm that the cut tube was fallopian tube and the region was isthmus. In case of modified polymerase method, these sutures that are being used would be of material that would dissolve spontaneously, and then the most of the time in case of modified polymerase method, the loop is not made, only the ligation is made. So the stitches are placed on the tube, and then tube is cut between these stitches on both sides. And the chances of failure in case of polymerase method is 0.4%. In case of modified polymerase method, it is reduced about to about 0.2%. And electrocautery is another method that is the most effective in case of laparotomy. The abdomen is open, and then the fallopian tubes, they are uh, recognized, and then electrodes are placed on the fallopian tube to burn the tissue. So there could be unipolar or there could be bipolar electrocautery. Electrocautery is the effective method being used for other tissues also, but it would burn a lot of fallopian tubes if it is bipolar. In case of bipolar, two electrodes are used. So these electrodes, they would burn at 2 points of the fallopian tube. So in case of unipolar, only one electrode would be used that would burn at only one level. So in case of electrocautery, the chances of reversal are very few. The timing of tubal sterilization could be postpartum, that is after giving birth, could be interval when the normal menstrual cycle is uh, playing, and then could be post-abortal after the abortion. So postpartum should be 7 days after giving birth. The mini laparotomy is performed. Mini laparotomy is that the whole abdomen is not cut, only 2 centimeter incision is made on the abdomen, because the reproductive structures, the tubes, they are larger in size because woman has just given birth. So the 2 centimeter incision is made, and the fallopian tube, they are uh, extracted out from this incision and ligated, and then placed inside the abdomen again. So local anesthesia would work. There is no need of general anesthesia in this case. So women, along with healing, cesarean uh, surgery. If there would be cesarean surgery, then the laparotomy would be performed along with birth, because the abdomen would be opened. But if the birth was normal, then mini laparotomy would be performed. That 2 centimeter incision would be made. So would heal during that time of the healing from the uh, cesarean surgery, or from the normal time of the inactivities of ovary during after birth. So then interval is done when the normal menses are being taken place. So after 7 days uh, after menses, so it could be laparoscopy, mini laparotomy, or laparotomy, the choice of the surgeon or the uh, woman would be. Then could be post-abortal, after abortion, and the ovaries, the laparotomy, or the laparoscopic surgery, or mini laparotomy would be performed. If we see advantages and disadvantages of contraceptive methods, we assess them with reference to their success of contraception. and then reversal if it is needed. So if we see the success, the most effective method would be electrocautery. So in case of electrocautery, we burn the tissues, so there would be very few chances that the ova they would pass and the sperm they would pass to meet uh, where the electrocautery would be performed. And then polymerase method would be the second most effective, and after that flow ring method would be the effective, and after that would be clip method. And in case of reversal, if we see the clip method, it would be the most effective method because it would be easily removed, and clips they damage the tubes very less, and the ends they could be ligated easily, their structures are not changed. In case of flow rings, because there is formation of a loop, so it would damage the uh, fallopian tube more as compared to clips. And then polymerase method, and again there is formation of a loop. And then electrocautery is the least effective in case if we want reversal, because the tissues they were damaged at both ends, and then it was so there could be bipolar cautery. When two electrodes are used, it would be least effective if we have to reverse, because it would damage tube at 2 point. And unipolar cautery would use only one electrode, so it would damage tube on one place only. So if we have to reverse the contraceptive method, then electrocautery is the least effective or least used method. Hysteroscopic tubal ligation is another process of contraception by blockage of the uterine tube, and this is done by a method that is called as Ashore. A spring-like coil along with a hysteroscopic camera would be passed into the through vagina into the fallopian tubes, and then the hysteroscope and camera they would be removed, and only the coil would be left in the uterine tube. And then there would be inflammation due to the external body in uterine tube, and there would be formation of a inflammatory scar in fallopian tube that would block the fallopian tube. So this whole process would take about 3 months. After 3 months, the stereo salpingography would be done. In this process, a dye would be injected in the fallopian in the uterus, and then X-ray detection would be done whether the dye would pass to the fallopian tube or not. If there would be blockage, there would be no dye or traces of dyes in the fallopian tubes. So this method is a permanent method like we do for surgery. So these methods that are to block or to cut the tubes, that is tubotomy or the blockage, they would be permanent. And the hysteroscopic tubal ligation, it is permanent but without surgery. Contraception during lactation uh, is very important, because normally it is thought that lactating women they cannot conceive because they have higher levels of prolactin that would suppress the gonadotropin hormone. But in case of lactation, it is not an absolute contraception. There is failure of about 2%. So it works if there is amenorrhea, mean if a woman is not having ovulation and the uh, normal menstrual cycle is ceased. So if women they are exclusively breastfeeding, mean their neonates they are not taking any other feed, they are only relying on breastfeeding. And then this protection, it is only for first 10 weeks of the birth. After 10 weeks there are chances of conception. So if women they are not fully breastfeeding, then they would ovulate even after 6 weeks, and if they are not feeding at all, they would ovulate after 3 weeks. So there is use of rule of 3 for these contraception, that when they have to take contraceptives, because after 3 weeks for non-feeding women they would ovulate, so they need contraceptives and in order to hinder unwanted pregnancies. And in case of women that are feeding, they should take contraceptive after 3 months, because after 3 months they would be ovulating. So there are methods that are being used for for lactating mothers. These pills they would be progesterone only pills or progesterone implants. There are chances of breakthrough bleeding through uterine due to thinning of the endometrium, but the combined estrogen and progesterone oral pills they are not recommended, because estrogen would be reflected in the milk, so it is not recommended for 6 months in the lactating mother, in order to avoid its adverse effect on the lactating child.